Well, there's two things that can cause hyperactivity. Carries the gene for ADHD. But don't be afraid of that medical term disorder, and that's a common cause of hyperactivity, but 20% of the time.
أنا لما بشوفك ضبيت نشاطك بنبسط كتير، مشان هيك أنا رح أخدك تلعب بحوض الرمل.
Hello, this is Dr. William again, and many parents come to us here at Adhd and ask, why is my child so hyperactive and what can I do about it? Well, there's two things that can cause hyperactivity. 80% of the time, it's genetic. What does that mean? Genetic means that either it runs on Baba's side of the family or Mama's side of the family. Some aunt or uncle, grandpa, grandma carries the gene for ADHD, which means attention deficit hyperactivity disorder. But don't be afraid of that medical term disorder, because disorder doesn't mean like it's a disease, something bad. It's just an academic term that we use to identify a variation from normal. So if a child is hyperactive, 20% of the time it's due to something that happened during pregnancy or right after birth. When the mother gave birth, maybe the child had oxygen deprivation, and that's a common cause of hyperactivity, but 20% of the time. Now, what could make it happen in the womb when the mother's pregnant, if the mother smokes hookah or cigarettes during that first trimester of pregnancy before she even knows she's pregnant, then that can affect the dopaminergic neurons in the brain so the child has higher energy. But as I stated before, 80% of the time, it's not due to some congenital anomaly, which means something that happens in the womb or right after birth, but due to genetics. Thank you for listening.
أنا عم ضد نشاط الإطفائي. أنا عم سكر غطا العلبة. أنا لما بشوفك ضبيت نشاطك بنبسط كتير، مشان هيك أنا رح أخدك تلعب بحوض الرمل.
أنا عم ضد نشاطي. أنا عم سكر غطا العلبة الخشبية. يلا. أنا عم سكر نشاطي. لما سويت نشاطك أنا انبسطت كتير، مشان هيك أنا رح أخدك لعند تيتا وجدو.